Okay. Yeah, certainly indigent care in the United States is a big problem. Uh, when we talk about moral issues, there's no moral issue with somebody losing their house. Um, if a fire occurs, that person will probably either go down to a motel and rent a room. They will call their mother or a brother or sister, move in with family for a little while. Um, if a hurricane strikes an area and it destroyed 1,000 or 2,000 homes, the government will open up shelters and school gymnasiums. The bottom line is you're going to find a place to sleep. The problem with health care is that when your life is threatened by a serious accident or illness, you only have one life and there's really no alternative. And we've decided in this country that we're going to save lives. There was a federal law passed in 1986 that basically says if you present yourself at the emergency room in an emergency situation, whether it be health related or an accident, serious accident, the ER, the emergency room, is required to treat the patient and stabilize the patient. So this gets to be a problem for hospitals because there's no actual requirement that people be able to pay for that emergency care. One of the abuses that we've seen in the system is that these hospital ERs, they do treat and stabilize a patient, but the patient needs continuing care, and instead of providing any kind of continuing care, a private hospital we've seen cases where they will simply call a cab and put a patient in a cab and tell the cab to take them downtown and drop them off downtown. There's a recent case in the city of Las Vegas, Nevada, where they've bought a Greyhound bus ticket and put a patient on a Greyhound bus, bought them a bus ticket to San Francisco, and they just shipped them out of state.
Those are great examples from one side of the equation as far as what the hospitals are doing to contain emergency care. As you and I know, and most our listening public hopefully knows, is emergency room care is the most expensive way. And so let's talk about the other side of the equation that maybe the social conservatives talk about, and let's give them some air on this too, where emergency rooms are full of people that really don't have life-threatening emergencies. They're there for painkillers or routine care. There are several cases on the East Coast about what they call the $1 million patients, to where a lady had diabetes, was severely overweight. She was put on medication, she was put on therapy, yet she would never use it. She would call emergency ambulances every 2 to 3 weeks and come in because her blood sugar was too high and she was having palpitations or whatever. Those are the things that kind of really load down the system. On a personal basis, I'll give you another example of a young man that's associated with one of my adopted daughters. He got into a fight with a knife. He has never worked. He's 23, 24 years old. And the city of Houston wound up paying his tab, which was about $1 million to stitch him back up, to get him on drug therapies, about 3 months that he stayed in coma. And now he's going to be on social welfare system. He's never going to be able to work because he never worked before the incident. Those are the things that drive the right-wing social conservatives crazy. On the left-wing side, they say everybody should be able to get care, everybody should be taken care of. That's an unsustainable model. We need to provide compassionate care like the rest of the world, the developed world, does. We need to be able to take care of people who actually need it, who can't afford it, but at the same time prevent some abuses. And I'll keep talking about some personal experiences to where my own father is 92 years old, and he's sitting there at home and he gets 24-hour care. Is it worth spending that kind of money to keep him going? So it's Medicare and Medicaid, which costs so much money in this country, is full of holes. It needs to be revamped. It needs to be readjusted to provide compassionate care. Would you agree with that before we run into the other side of the equation about exorbitant pricing allowed in the system, where Medicare and Medicaid cannot negotiate pricing on drugs?
I do agree that we certainly need substantial reform. When you talk about how does the rest of the world work, you can also look at the Canadian and British and most of the Scandinavian systems. They are on a different model where they really don't have private insurance companies involved in their healthcare system. They have what's called a single payer model. The healthcare system really is run by the government, and basically everyone is covered. Everybody pays their taxes into the system, and the tax money pays the doctors, the hospitals, and so you don't really have this question about what to do with indigent patients. They're really covered by the system.
Well, that's a great point. You brought in the Canadian system and the English system, and I hear a lot of complaint from some folks that say, "Hey, those systems in England and Canada, you have to wait a long, long time, long waits to get into care." On several personal bases, a friend of mine who used to play for the Edmonton Oilers, his father had to be put into a nursing home in Canada. He was able to get care within 2 or 3 days, and very, very good care. And when I say 2 or 3 days, meaning from the time it was determined that he could not take himself to where he was placed in a nursing home, took 3 days. I don't think that can happen in America right now. We seem to be very proud of our system, but there are quite a few holes. What I think the rest of the world does, like say in Japan, is I think they have a different model, as you say, a single payer system. And if you can afford to get other care, you can. It's not denied to you, but the baseline care is provided to you, and it gets rid of a lot of fraud and scams. Up to you now.
Yeah, and you know the social conservatives complain, and then they quickly point to certain deficiencies in the single payer model. Certainly, there are some wait times to see physicians or to get certain procedures performed. You can get an MRI, but there are not that many MRI machines in the system, and you may have to wait a month or 2 or 3 months to get an MRI. But one of the advantages is that those nations are not going broke because of health care. The United States spends about 17% of its gross domestic product on health care. British and the Canadian system spend about 11%.
Yeah, that's a very interesting point to where Japan as a whole has less nurses per patient. If I remember correctly, it's like 7 to 8 nurses per patient is the rule in America, whereas in Japan it's 14 to 15 patients per nurses. And if you look at the satisfaction rating, the culture in Japan is about much more tolerant and accepting of what's going on, but the patients seem to do better. They come out earlier. They seem to be happier with the service they received. Whereas in America, I personally believe, and there's a lot of data to back it up, that we are probably the best diagnostic system in the world, and probably is one of the best cancer recovery system in the world. But as a general rule, we're not the most efficient, productive system in the world.